Nick Chubb just had an absolutely gruesome season-ending knee injury, and in this video, we're going to talk about exactly what happened, what might be damaged, and why this is definitely season-ending. So, as you can see, Nick Chubb gets hit with a valgus stress. That means a stress coming from the outside. Also, while it seems like his foot is planted, and that causes his knee to be hyperextended, as well as being hit with this outside force. Now, a common injury they teach that can happen from football with this valgus stress in medical school is known as the unhappy triad. This is when you have a tearing of the ACL, the medial collateral ligament, the MCL, as well as the medial meniscus. It's very likely that the meniscus and these two other ligaments were torn, but because of the severity of this injury, there's even bigger concern at play, which the trainers and the doctors were probably checking for right away. So, if you have such a high impact traumatic injury, you could actually have a knee dislocation and you can have an injury to the popliteal artery, which runs behind the knee. Now, this can be very bad. It can cause severe bleeding and can technically be life threatening. And that is why it's very important for an injury like this to go to the hospital immediately to get checked out and to make sure that the athlete is in stable condition. Additionally, a knee dislocation is generally due to a trauma like this and usually means that many ligaments have been torn. And the way to check for this is if you fully extend the knee and then give either like a valgus or varus stress, you'll generally see that the knee is lax everywhere. So reports are already showing that he will be undergoing surgery. My guess is at the very least, he's probably going to have some sort of ACL or MCL repair. Hopefully, it wasn't too bad of a dislocation and there was no popliteal artery injury, but this was most certainly a gruesome injury. Will put Nick Chubb out for the season and will require a lot of physical therapy after the surgery to come back strong. Now, luckily, these athletes get some of the best therapy and their full-time job is to get better, but it's always unfortunate to see a season-ending injury. I'm wishing Nick Chubb the best. Hopefully the surgery went well and he has a full recovery. That's all for this video. If you're enjoying these sports medicine breakdowns, I'd love for you to like and subscribe, or just subscribe. You don't even have to like, and I will see you in the next video.